Hi, it's Dr. Russ Marchese here to talk to you about some of our upgrade options available to you with customized cataract surgery. In a standard cataract surgery, insurance will cover the cost of the intraocular lens that we insert into the eye during the procedure. This is a great option for many people, but if one of your goals is to limit your use of glasses, you may want to consider customized cataract surgery. It comes with extra out-of-pocket cost, but gives you additional freedom from glasses. Let's go through some slides to learn more. So what is customized cataract surgery? There are two main reasons for customized cataract surgery. Number one, if you have astigmatism and want to be less dependent on glasses in the distance. And two, anyone who wants to be less dependent on reading glasses and enjoy a greater range of good vision at different distances. And of course, both. So what is astigmatism? Astigmatism is an irregular shape to the front of the eye, the cornea. In a typical eye, the cornea will be round and spherical, like a basketball or soccer ball. But with astigmatism, it will be oval shaped or have an irregular shape like an egg. In the pictures here, you can see the arrows highlighting the front of the eye, the cornea. The top picture has a round basketball-shaped cornea without astigmatism. The bottom picture has astigmatism with an oval shape or an egg-shaped cornea. You'll notice that the cataract is behind the cornea, and when we do cataract surgery, we take out this cataract, but we do not change the front of the eye or the cornea and the astigmatism. There are still ways to treat that astigmatism. The main way to do that is with a toric astigmatism correcting intraocular lens. The toric intraocular lens helps account for that irregular shape in the cornea to help improve your vision. So let's look at some examples of what that looks like for you. All of the following images are simulations. Actual results may vary. The left image shows what it may look like with astigmatism, whereas the right image shows when astigmatism is corrected, as with the toric intraocular lens. We have a similar representation here, with astigmatism represented in the left picture and normal vision with corrected astigmatism represented in the right picture. And finally here, the top picture shows what vision can look like with a toric astigmatism correcting lens versus vision with mild astigmatism on the bottom. So, does a toric astigmatism correcting lens completely eliminate my astigmatism? No, but it can significantly decrease your astigmatism. This gives you a better chance to function well without glasses for distance activities like watching TV, especially when compared to the basic lens. So let's check out this diagram on the bottom to better understand this. Imagine the green area as functional vision, or vision that allows us to do our daily activities and do them well. On the left of this chart is poor vision, and on the right of this chart is perfect vision. You'll notice that we won't get to perfect vision in this demonstration. That's because there is no lens that can bring us back to our 18-year-old eye. The left dot in this diagram is our vision with a cataract. The right dot in this diagram is our best possible vision for our age. With the basic or standard lens that insurance covers, we expect the vision to improve. Without glasses on, however, you still might not have functional vision in the distance. With a toric lens, it gives you a better chance of getting closer to your best possible vision for age without glasses on. It also decreases the strength of your glasses that are needed to reach your best possible vision for age. This demonstrates that even with the basic surgery, you should be able to reach your best possible vision for age, but it requires a large glasses prescription. Whereas with the toric lens, you have more functional vision without glasses and a smaller glasses prescription to reach your best possible vision for age. Now here's one thing I hear pretty frequently. I don't have any astigmatism in my glasses, or I don't wear any glasses now. Do I still need a toric intraocular lens? The answer is, sometimes you do. The reason is this: astigmatism comes from the front of the eye, the cornea. Sometimes with the cataract has a shape that can counteract the astigmatism from the front of the eye. While it is making the vision blurry, It's counteracting the astigmatism and improving your prescription in one way. When we take out the cataract, all that is left is the cornea. If you have an irregularly shaped cornea in the front of the eye, it might not be noticed until we take out the cataract. For that reason, we say that you may still have astigmatism that can affect your vision after cataract surgery, even if you currently don't wear glasses or if you don't have any astigmatism in your current glasses. For folks who already have astigmatism, this might also mean that you have more astigmatism and a stronger pair of glasses after cataract surgery if you do not choose the toric intraocular lens. This situation isn't common, but it's important to understand, especially if decreasing the strength of your glasses and increasing your freedom from glasses is important to you. We take preoperative measurements of your eyes at your surgical scheduling appointment. There, we will let you know if your astigmatism is large enough that you would benefit from a toric IOL. So let's return to our second reason for customized cataract surgery. Anyone who wants to be less dependent on reading glasses and enjoy a greater range of good vision at different distances. Even if we correct your astigmatism, your reading vision will still be blurry without glasses on. This is represented in the picture below, as well as the next picture. So when talking about our reading vision and our range of vision, it's important to understand what presbyopia is. Presbyopia is a normal aging process where our eyes gradually lose the ability to see both near and far images with the same prescription. This usually results in the need for reading glasses, bifocal glasses, or taking off your distance glasses to read if your eyes are nearsighted. It is important to understand that even if you are not currently experiencing symptoms of presbyopia, standard cataract surgery will result in presbyopia, or the inability to see at all distances without glasses. Now, there are some options to treat presbyopia, and we're going to go over those now. The first is something called monovision, where we have one eye targeted for the distance and one eye targeted for near vision. We generally do not recommend this option because it is a permanent change that comes with the risk of both eyes not working well together. The most common solution for presbyopia correction at the time of cataract surgery are presbyopia correcting intraocular lenses. These increase your range of vision over multiple distances. There are two main types of presbyopia correcting lenses. The first is an extended depth of focus lens, and the second is a multifocal lens. We'll go over both of those. Extended depth of focus lenses help us see well in the distance and at an intermediate length. This can help us do things like see the dash when we are driving, work at a computer, or even see your cell phone without glasses on. With the basic lens, we would expect the dashboard, cell phone, and computer vision to all be blurry without glasses on. So let's take a look at an example. To start off, we'll show a picture of a cataract, which is on the left side of this image. You'll notice the colors and clarity of the image are dull at all three distances: distance, intermediate, and near. On the right side of this image, you will see an example of a monofocal or monofocal toric lens. These lenses are both single distance lenses. Here you will notice that the distance vision is clear, but there is blurry vision at the intermediate range at the computer, as well as at the near range at the coffee mug. Let's take a look at an example of the extended depth of focus lens now. You'll notice here that the distance vision is clear, but this time we have an improved range of vision with clear vision at the intermediate range at the computer and improved vision up close at the coffee mug. You'll notice that the coffee mug is still a little blurry, but the quality of vision is much improved compared to the basic or monofocal toric lenses. I'll toggle back and forth between the basic or single distance lens and the extended depth of focus lens so that you can see the difference. Try focusing on the computer and reading vision to see the main differences. Here's the basic lens and the extended depth of focus lens. And again, the basic lens and the extended depth of focus lens. Now let's look at the second type of lens that helps us improve our range of vision, called the multifocal lens. The multifocal lens will help us see well in the distance, in the intermediate, and up close. So you might be asking, why isn't this the obvious choice for my intraocular lens? The reason is that every function comes at a cost. The multifocal lens has the greatest chance of experiencing side effects like glare and halos. Some people also notice that the quality of their distance vision isn't as good as a monofocal or monofocal toric lens. The extended depth of focus lens, in contrast, has fewer side effects than the multifocal lens in terms of glare, halos, and the quality of distance vision. For many people, the extended depth of focus lens offers a good amount of increased range of vision without a dramatic increase in the risks of the lens like the multifocal lenses. For example, if you look at the pictures here, you can imagine the top two pictures as likely representations of side effects with the monofocal lens or an extended depth of focus lens, whereas the bottom two pictures are expected side effects with the multifocal lens. Again, any intraocular lens that increases the range of vision comes with an increased risk of possible side effects. With the extended depth of focus lens, those side effects are typically mild, especially in comparison to the benefits they bring. With a multifocal lens, we expect those side effects to be common and more significant. Ultimately, it comes down to your priorities. Many patients believe that the differences between the monofocal or single distance lens, shown here, and the extended depth of focus lens, shown here, are well worth the increased risk of mild side effects with the extended depth of focus lens. It is less common for my patients to believe that the difference between the extended depth of focus lens, shown here, and the multifocal lens, shown here, are worth the significant and dramatic increase in side effects with the multifocal lens. Now, what lens is right for you? What I want you to remember is there is no perfect lens. If there was one perfect lens option, I would tell you. But unfortunately, there is no perfect option, and don't let anyone tell you otherwise. All lenses have pros and cons, and every additional function comes at a cost. For instance, the perfect lens would have only green for all the categories on this chart. That lens doesn't exist, unfortunately. So you have to decide the most important things to you. Your decision comes down to your priorities. You won't find me telling you there's an absolutely right choice for you because my priorities may be different than yours. What I will do is let you know which of these options I would not recommend based on your specific exam findings. Some helpful questions you might ask yourself are included on this chart. Do I want to reduce my glasses dependence? Do I want to increase my range of vision in order to reduce my reading glasses dependence? Do I want to increase my range of vision in order to reduce my reading glasses dependence? How important is my distance vision quality in relation to these other features? How important are the risks of glare and halo side effects to me? Before leaving, I wanted to go over some take-home points. No lens or eye surgery is perfect, and there is no lens or procedure that can make us see as well as we did when we were 18 years old at all distances. Customized surgery is a great option to reduce your dependence on glasses, both in the distance and up close, but you will likely still need some form of glasses at least some of the time. Ultimately, it is your vision and your decision, and I want to help you make an informed decision that is best for you. Hopefully this video gets you part of the way there. In addition to the video, please read the consent form and don't hesitate to ask any follow-up questions that remain.